Master the C drugs. Here's the 25 most common medications tested. How many do you recognize? Calcitonin is used to treat osteoporosis and hypercalcemia. Calcitriol is used to treat hypocalcemia and metabolic bone disease in people with kidney disease. Candesartan is used to treat high blood pressure and heart failure. Capsaicin is used to relieve pain from conditions like arthritis, muscle aches, and nerve pain. Captopril is used to treat high blood pressure, heart failure, and diabetic kidney disease. Carbamazepine is used to treat seizures, trigeminal neuralgia, and bipolar disorder. Carbidopa/levodopa is used to treat Parkinson's disease. Carboplatin is used to treat various cancers, including ovarian, lung, and head and neck cancers. Carvedilol is used to treat high blood pressure, heart failure, and to reduce cardiovascular mortality after a heart attack. Cefazolin is used to treat and prevent various bacterial infections, often given before surgery. Cefdinir is used to treat bacterial infections such as bronchitis, pneumonia, and ear infections. Cefepime is used to treat severe bacterial infections, including pneumonia and urinary tract infections. Ceftriaxone is used to treat a wide range of bacterial infections, including meningitis, gonorrhea, and severe skin infections. Celecoxib is used to relieve pain and inflammation from conditions like arthritis and menstrual cramps. Cephalexin is used to treat bacterial infections of the skin, bones, ears, and urinary tract. Cetirizine is used to relieve symptoms of allergies like sneezing, runny nose, and itching. Chlorhexidine is used as an antiseptic to clean skin, wounds, and as a mouth rinse for gum disease. Chlorothiazide is used to treat high blood pressure and edema, fluid retention. Chlorpromazine is used to treat psychotic disorders like schizophrenia and severe nausea and vomiting. Cholestyramine is used to lower high cholesterol levels and to treat itching caused by liver disease. Ciprofloxacin is used to treat a variety of bacterial infections, including urinary tract infections, respiratory infections, and skin infections. Cisplatin is used in chemotherapy to treat various cancers, including testicular, ovarian, and bladder cancers. Citalopram is used to treat depression. Clindamycin is used to treat serious bacterial infections, including skin, respiratory, and gynecological infections. Clonazepam is used to treat seizure disorders and panic disorder. Let's keep going. Here are the adverse reactions of the C drugs that exams love to test. 1. Calcitonin. Adverse reactions: nausea, flushing of face and hands, local inflammatory reactions at injection site, rhinitis, nasal spray, headache, back pain. Calcitriol. Adverse reactions: hypercalcemia symptoms, nausea, vomiting, constipation, headache, polyuria, polydipsia, weakness, hyperphosphatemia, metallic taste. Candesartan adverse reactions: dizziness, headache, fatigue, back pain, upper respiratory tract infection, hyperkalemia, hypotension, angioedema, rare but serious. Capsaicin adverse reactions: burning, stinging, redness, pain at application site, usually temporary, cough if inhaled. Captopril adverse reactions: cough, dry persistent, dizziness, fatigue, headache, hypotension, hyperkalemia, angioedema, rare but serious, taste disturbance. Carbamazepine adverse reactions: dizziness, drowsiness, ataxia, nausea, vomiting, blurred vision, leukopenia, hyponatremia, skin rash can be severe, for example, SJS. 10. Carbidopa/levodopa adverse reactions: nausea, dyskinesias, involuntary movements, orthostatic hypotension, hallucinations, dizziness, somnolence. Carboplatin adverse reactions: myelosuppression, thrombocytopenia, leukopenia, anemia, nausea, vomiting, peripheral neuropathy, ototoxicity, alopecia. Carvedilol adverse reactions: dizziness, fatigue, bradycardia, hypotension, weight gain, edema, hyperglycemia. Cefazolin. Adverse reactions: diarrhea, nausea, vomiting, rash, pain at injection site, hypersensitivity reactions, for example, anaphylaxis. Cefdinir. Adverse reactions: diarrhea, nausea, abdominal pain, headache, rash, difficile-associated diarrhea. Cefepime. Adverse reactions: diarrhea, nausea, vomiting, rash, headache, fever, encephalopathy, especially in renal impairment, seizures. Ceftriaxone. Adverse reactions: diarrhea, rash, injection site pain, elevated liver enzymes. Difficile-associated diarrhea, gallstone-like formation in gallbladder, biliary pseudolithiasis. Celecoxib. Adverse reactions: abdominal pain, diarrhea, dyspepsia, nausea, headache, increased risk of cardiovascular thrombotic events, for example, MI, stroke, GI bleeding/ulceration. Cephalexin. Adverse reactions: diarrhea, nausea, vomiting, abdominal pain, rash, candidiasis. Cetirizine. Adverse reactions: drowsiness, fatigue, dry mouth, headache, dizziness. Chlorhexidine. Adverse reactions: oral irritations, staining, mouth rinse, skin irritation/rash, topical, rare severe allergic reactions, anaphylaxis. Chlorothiazide. Adverse reactions: hypokalemia, hyponatremia, hyperglycemia, dizziness, orthostatic hypotension, photosensitivity, muscle cramps. Chlorpromazine. Adverse reactions: sedation, orthostatic hypotension, dry mouth, blurred vision, constipation, urinary retention, extrapyramidal symptoms, for example, dystonia, akathisia, Parkinsonism, tardive dyskinesia, long-term, neuroleptic malignant syndrome, rare but serious. Cholestyramine. Adverse reactions: constipation, abdominal pain, bloating, nausea, flatulence, heartburn, vitamin K deficiency, rare. Ciprofloxacin. Adverse reactions: nausea, diarrhea, abdominal pain, headache, dizziness, tendinitis, tendon rupture, black box warning. Peripheral neuropathy, black box warning. QT prolongation. Cisplatin. Adverse reactions: severe nausea and vomiting, nephrotoxicity, ototoxicity, high-frequency hearing loss, peripheral neuropathy, myelosuppression, electrolyte disturbances, for example, hypomagnesemia. Citalopram. Adverse reactions: nausea, dry mouth, insomnia, somnolence, sweating, tremor, sexual dysfunction. QT prolongation. Clindamycin. Adverse reactions: diarrhea, nausea, vomiting, abdominal pain, rash. Difficile-associated diarrhea, black box warning. Clonazepam. Adverse reactions: drowsiness, dizziness, ataxia, fatigue, memory impairment, dependence, and withdrawal. Let's finish strong by doing the contraindications and black box warnings of the C drugs. Calcitonin. Contraindications: hypersensitivity to calcitonin salmon. Black box warning: none. Calcitriol. Contraindications: hypercalcemia, vitamin D toxicity. Black box warning: none. Candesartan. Contraindications: hypersensitivity to candesartan, concomitant use with aliskiren in patients with diabetes. Black box warning: drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue as soon as pregnancy is detected. Capsaicin. Contraindications: hypersensitivity to capsaicin. Do not apply to broken or irritated skin. Black box warning: none. Captopril. Contraindications: history of angioedema related to previous ACE inhibitor treatment, hereditary or idiopathic angioedema, concomitant use with aliskiren in patients with diabetes or renal impairment. Black box warning: drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Discontinue as soon as pregnancy is detected. Carbamazepine. Contraindications: history of bone marrow depression, hypersensitivity to carbamazepine or tricyclic antidepressants, concomitant use with MAOIs, or within 14 days of discontinuing, black box warning, aplastic anemia and a granulocytosis can cause serious and sometimes fatal blood dyscrasias. Serious dermatologic reactions can cause severe skin reactions, e.g., Stevens-Johnson syndrome, toxic epidermal necrolysis, especially in patients of Asian ancestry with HLA-B 502 allele, carbidopa/levodopa, contraindications, narrow-angle glaucoma, suspicious undiagnosed skin lesions, or history of melanoma, concomitant use with non-selective MAOIs within 14 days, black box warning, none, carboplatin, contraindications, severe bone marrow depression, severe bleeding, hypersensitivity to cisplatin or other platinum-containing compounds, or mannitol. Black box warning. None, though severe myelosuppression is a major dose-limiting toxicity. Carvedilol. Contraindications. Decompensated heart failure requiring intravenous inotropic therapy, bronchial asthma or related bronchospastic conditions, second or third degree AV block, unless a permanent pacemaker is in place, sick sinus syndrome, unless a permanent pacemaker is in place, cardiogenic shock, LP, severe bradycardia, severe hepatic impairment, hypersensitivity to carvedilol. Black box warning, abrupt discontinuation may exacerbate angina symptoms, myocardial infarction, and ventricular arrhythmias in patients with coronary artery disease. Cefazolin. Contraindications, hypersensitivity to cefazolin or other cephalosporins, or to penicillin due to potential for cross-reactivity. Black box warning, none. Cefdinir contraindications, hypersensitivity to cefdinir or other cephalosporins. Black box warning, none. Cefepime contraindications, hypersensitivity to cefepime, cephalosporins, penicillins, or other beta-lactam antibiotics. Black box warning, none, though serious neurological adverse events, including encephalopathy and seizures, have been reported, especially in patients with renal impairment. Ceftriaxone contraindications, hypersensitivity to ceftriaxone or other cephalosporins, neonates with hyperbilirubinemia, especially premature neonates, due to risk of bilirubin encephalopathy, concomitant use with calcium-containing intravenous solutions in neonates. Black box warning, none. Celecoxib contraindications, history of asthma, urticaria, or other allergic-type reactions after taking aspirin or other NSAIDs, coronary artery bypass graft, is CABG surgery, contraindicated for the treatment of perioperative pain. Black box warning, cardiovascular thrombotic events. NSAIDs increase the risk of serious cardiovascular thrombotic events, myocardial infarction, and stroke, which can be fatal. This risk may increase with duration of use. Gastrointestinal risk. NSAIDs increase the risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. Cephalexin. Contraindications, hypersensitivity to cephalexin or other cephalosporins, or to penicillin, due to potential for cross-reactivity. Black box warning, none. Cetirizine contraindications, hypersensitivity to cetirizine or hydroxyzine or any component of the formulation. Black box warning, none. Chlorhexidine contraindications, hypersensitivity to chlorhexidine, used as a preoperative skin preparation for surgical procedures involving the head or face due to risk of corneal damage, used for lumbar puncture or in contact with meninges. Black box warning, none, though rare, serious allergic reactions, including anaphylaxis, can occur. Chlorothiazide. Contraindications, anuria, hypersensitivity to chlorothiazide or other sulfonamide-derived drugs. Black box warning, none. Chlorpromazine, contraindications, comatose states, presence of large amounts of CNS depressants, e.g., alcohol, barbiturates, opioids, bone marrow depression, hypersensitivity to phenothiazines, Black box warning, increased mortality in elderly patients with dementia-related psychosis. Not approved for this use. Cholestyramine contraindications, complete biliary obstruction, hypersensitivity to cholestyramine resin. Black box warning, none. Ciprofloxacin, contraindications, concomitant use with tizanidine, hypersensitivity to ciprofloxacin or other fluoroquinolones. Black box warning, tendinitis and tendon rupture. Increased risk, particularly in elderly patients, those on corticosteroids, and kidney transplant recipients. Peripheral neuropathy can cause sensory or sensorimotor axonal polyneuropathy, central nervous system effects, seizures, increased intracranial pressure, toxic psychosis, exacerbation of myasthenia. Gravis can exacerbate muscle weakness, aortic aneurysm and dissection, increased risk, used for uncomplicated urinary tract infections, acute bacterial exacerbation of chronic bronchitis, and acute sinusitis should be reserved for those with no alternative treatment options. Cisplatin, contraindications, severe renal impairment, myelosuppression, hearing impairment, hypersensitivity to cisplatin or other platinum-containing compounds, or mannitol. Black box warning, nephrotoxicity can cause severe cumulative renal toxicity. Ototoxicity can cause severe and cumulative ototoxicity. Myelosuppression can cause dose-related myelosuppression. Nausea and vomiting can cause severe, prolonged, and refractory nausea and vomiting. Anaphylactic-like reactions can cause severe anaphylactic-like reactions. Citalopram. Contraindications. Concomitant use with MAOIs or within 14 days of discontinuing. Concomitant use with pimozide. Hypersensitivity to citalopram. Black box warning. Increased risk of suicidal thoughts and behavior in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders. Clindamycin. Contraindications. History of hypersensitivity to clindamycin or lincomycin. History of antibiotic-associated colitis. Black box warning. Can cause severe and possibly fatal colitis. Discontinue if significant diarrhea occurs. Clonazepam. Contraindications. Acute narrow-angle glaucoma, severe liver disease, hypersensitivity to clonazepam or other benzodiazepines. Black box warning. Concomitant use with opioids may result in profound sedation, respiratory depression, coma, and death. Reserve concomitant prescribing for use in patients for whom alternative treatment options are inadequate. Always remember this information is for educational purposes and should not replace comprehensive drug references or professional medical advice.